I'm sorry. I think I was very intrigued by what their claims are, so I went on their website and looked at what they use. They use this little instrument called a curoscope, where they go in through a little caudal opening in the back, and they're able to then use laser to shrink the discs. I think in a small minority of cases, I'd have to look at your MRI to tell you if you're a good candidate. If you have a small disc bulge, and that is the cause of your problems, at the lowermost levels where that scope can get to. So they say they can get all the way up to the neck. You know, that's obviously not possible. You can probably get to 1 or 2 levels, so L5 and L4-5. They have never submitted anything for publication in a peer-reviewed journal. So none of their work has been peer-reviewed, meaning we are all sitting here. If I say something crazy, you know, 3 of these will stop me and say, Dr. Malik, that's not exactly how it's done, because these are my peers. So how we review one another is we send what we do after we've done 50 cases to a journal. And the journal has peer-reviewed authors who read that and say, yes, this seems reasonable. This is a new technology. Let's make sure everybody adopts it. And that's how all of us adopt new technologies. What they do has not been sent to any publication, has not been peer-reviewed. So I myself am very skeptical of their results. They're going to ask you for a lot of money. And, you know, what do you have at the end of that? At least if you come to one of us, we'll tell you these are your risks. These are your possible expectations. If you are jogging 6 miles, my obvious question is, if you're still able to jog 6 miles, why do you need surgery?
With the constant pain of it after I work out, which seems to be helping the matter. It would only get worse if I was just dormant, not doing anything.
Correct. So
I get out of the truck after driving home from the park, and it seems like I can't walk with the right leg. Or
yeah.
My son says, Dad, what's wrong with you? You know?
So if I were advising you, I'd say cut it down to 3 miles and see if you still hurt. You see, that's a very simple thing. I'm a runner.
It's not the running that's called.
Yeah.
It's going back to the traction of some sort.
And I understand that, and this is something that, you know, we deal with very often. People who are very active, who have a real problem, and sometimes are looking for relief. It's very hard to give you a good answer without really examining you or looking at your MRI.